Well, good morning and welcome to the State of Palliative Care Across Settings. What can we do together? This conversation represents some dynamite expertise across the country. It was originally scheduled to take place on October 16th, immediately preceding the Grantmakers and Aging Conference that was in Kansas City at that time, but unfortunately we all experienced the government shutdown, and Kathy was unable to join us for that meeting, and we postponed it to December. And then, as a result of the fact that that change kind of interfered with a number of your schedules, we gave it one more shot and asked her if we could celebrate Kansas Day and come to Washington. And she said, of course, being an old Kansan herself, so she said, bring it on. So here we are today, hopefully celebrating what I think will be a very exciting opportunity for all of us. That we have assembled, I think, the greatest group of palliative care experts in the country, and I am not only grateful but humbled by your response to the request that we sent out. This is a great, great day for us. A number of people will be coming in and out through the course of the day. We are hopeful that Senator Warner will be here in a few minutes, and we'll take him as soon as he is. 10 minutes away, all right. And Kathy will also be making some opening remarks. I do have a few housekeeping chores I'd like to go over with you, if you don't mind. If you'd open up your packets, there is a notice, special notice on the right side of the first sheet. This whole session, the entire day, will be digitally recorded. We will be placing it on YouTube. We need your permissions, or not, excuse me, it's an opt-out. If you do not give us permission, we're assuming permission from everybody for the distribution of any speaking that you do. We also need you to give a business card, if you have it, to Cindy Leyland. You want to stand up and turn around and wave, Cindy? Because we're going to make your contact information available to all persons, everybody on the World Wide Web. We will only make your email available to the people in this room unless you instruct us to go ahead and make that available to everybody as well. But everybody in this room will receive your email unless you give us an alternate, and then that alternate email address will be provided to all the other participants here. So if you've got any questions, please see Cindy throughout the course of the day. Around the perimeter of the room, there are a number of the models that will be presented this afternoon that will be on display. You'll have time to visit with them during the break. Dr. Peggy Batten, who will be our lunch speaker, has really 30 full minutes of presentation. So what we're going to do is she's going to finish her remarks. We're going to go to the adjacent room to pick up our lunch. Those of you who want to come back for a Q&A session with her will be in this room. Those of you who want to take care of other business or visit or network, if you'll stay in that lounge area, then we won't be disturbing the group that reassembles in here to have discussions with Peggy regarding her presentation. And the only other item for those of you, we have a pretty good mix of male-female. I was kind of concerned that we might have some problems with the accommodations for women are quite limited in this building, and so I would suggest that rather than you waiting for a break, you might, if you need to use the facilities, use them when you need to use them as opposed to waiting for a formal break. There are only 2 stalls in the entire building for women to use publicly. So I apologize for that. Unless you're a guest and you still have your card, you can actually get to the fitness center and you can use the restroom there. So anyway, that's a palliative care need that all of us have, and I want to make sure your symptoms are relieved. Also, I know this is kind of tight quarters. We've had 2.5, I guess, almost 3 days worth of terrific meetings with the PAINS Project, which is one of the reasons that we're here in this room. The center sponsors the National PAINS Initiative. Myra's been working on that, so we've been kind of housed in this area for the last 3 days. So we're appreciative of your willingness to kind of put up with this to carry on the message. With that, I'm going to take the next couple minutes and introduce an old friend of mine from Kansas that we've probably known each other close to 20 years now. I met Kathy when she was the ombudsperson for the state of Kansas. For Governor Sebelius, she basically took on a challenge. We had some significant challenges in aging issues in Kansas. Governor Sebelius turned to her chief of staff at that time and said, "Kathy, I need some help." And Kathy stepped up. And when we began the conversation about this meeting, I knew this was going to work because this woman is committed not only to, I think, the work that we're all doing, but also to the people who are most vulnerable in society, especially those in long-term care settings and in community dwelling as well, and very committed to making sure that that happens. So it is a great honor for me to introduce her to you today and to ask her to share a few words as we open today's meeting.
When the senator gets here, we'll stop. So someone just give me the high sign. Happy Kansas Day. You all hadn't celebrated Kansas Day before, had you? So some of us have. Hi, Doug. I don't come from any state other than Kansas, so I don't know how the rest of you all do it, but we're quite proud of our history, and we know when it's Kansas Day. So it's really, I mean, it's, and I find in the East Coast they have no idea about the history of Kansas and our role in the Civil War and all that stuff. So we keep updating the rest of the nation about our value. I want to thank John and Myra and the staff at the Center for Practical Bioethics for planning this twice, for all of the work it took to put this together in October, and then to move it bounced on December briefly before having it here in Washington. It really had been my hope that I could come back to Kansas City, I could come home, and we could have this conversation. One of the benefits of having it in Washington is that we will have the ability to have quite a number of my staff participate today, as well as a broader array of federal partners from Health and Human Services that we would not have had in Kansas City. So I know that there's life outside of Washington. There are times by being here that you have access in a way that you just can't quite achieve in other places. There's a lot of experts in the room. I'm going to be here all day. I'm very much looking forward to learning. In my role, I have told people that I often don't attend conferences. I visit podiums, and I usually leave. And I don't usually have the chance to sit all day and just learn. So thank you in advance for everything you're going to teach me today. I mean, this is a tremendous opportunity for me personally to learn so much from the field. I want to talk about sort of my end of what led up to today. In the fall of 2012, when it seemed that we would have a second term in the Obama administration and I would have the opportunity to remain as Assistant Secretary, I started to think about what are the issues that we have not been talking about, because I am an advocate, a diehard advocate through and through, and I feel like both the honor and the responsibility of being Assistant Secretary really require that I lift issues that are otherwise not getting enough attention. I spend, for example, a great deal of time working on the topic of elder abuse. It is an issue I'm passionate about. I talk about it in every speech, and it's the kind of issue where we need more national voice. In the fall of 2012, in thinking about kind of what else is there, I really started this journey by thinking more specifically about end of life, and that has broadened to include hospice and palliative care and the full range of issues that we're going to talk about today. Realizing that we spend a lot of time, and we do this at HHS, talking about how to help people age in a way that's healthy and prevent chronic disease, but they will die from something. And diseases become unmanaged, and we need to talk about a person-centered approach to palliative care and how we can continue to talk about advanced illness and even, yes, death, because this does happen. And I find in the field of aging, there really isn't enough conversation about that whole spectrum. So I began to have meetings and I met with a whole range of people, Diane Meyer, and learned the work that she's been doing. I met with a number of hospice providers. I met with Carol Blackford, who's the head of the Medicare benefit, the hospice benefit. I met with disability advocates. I really just started to reach out and meet. And when I did that, I found something that I was very grateful for. I didn't realize what a good foundation I had from my time as serving as Secretary of Aging in Kansas. And so I want to give my hats off to the Sunflower Foundation for their support today, but this is not the first time Billy and I have worked together, or Doug Farmer. I mean, there are wonderful advocates in the Midwest, and you all gave me tremendous foundation. I was hoping to see Donna Bales here today. And there's just an energy coming from the center of the country to focus on these issues. And I think it's important and quite appropriate that we focus on these issues on Kansas Day. So I'm proud to be a Kansan. I'm proud for what you all have taught me. But I need updated information. I mean, I have been here now almost 5 years, and I need to know where I can add my voice, what I can do with the agency that I lead, but also as an Assistant Secretary at Health and Human Services so that we can bring more perspective, make policies, program changes, and really move the issue forward. I've found in doing this work that one of the hardest voices, I guess, in terms of looking for people to provide information are real people, actual consumers. I am a longtime public servant, you all know that, and it's always important that we check through mentally who are we getting input from. Are we getting a broad range of input? And I find that hearing directly from consumers in this space is a little challenging. And so how do we continue to plan services, plan policy with the person at the center of what we're doing and with their voice at the table? And often, because we're talking about end-of-life issues, the closest voice may be a family caregiver. And so how do we make sure we get a full range of input and support? So that was my kind of mental thinking that led to today. And I had well, if you sit with Myra and have wine for 2 hours, you end up with a full day like this. And she came to town, and we talked about, unmitigated pain. We talked about the need for more palliative care, more hospice services, and sort of the full range. And I basically said, if I gave you the day, what could we do with it? And we've put together this wonderful team of individuals. So, Myra, it worked from the time we met. I wanted to go through and talk about then a little bit more specifically what we have been doing and what our goals are. We would really like to focus on how we support person-centered planning. This is and needs to connect to all the other type of person-centered planning that we do as people move from being patients to returning to their communities. And the person-centered supports and services are key to addressing their symptoms. Goals at end of life are really valuable and important. So I had the opportunity to speak at the CTAC conference, their national meeting almost a year ago here in Washington. I met and had a chance to attend the World Health Assembly in Geneva in May, and I was on a palliative care a side event. I met Jim Cleary, that I know is on the list. I don't know if Jim, the back, I met Jim there. So I've started to try to figure out how to kind of give voice to the bully pulpit, what I can do to talk. We know that palliative care services need to be accessible. They need to be available in all settings. I think it's really important that we talk about that, and I'm so glad that our partners from CMS are here as we talk about community-based palliative care. They need to be available anytime. We need to work through both the Administration on Aging and Administration for Community Living to help consumers and caregivers know about palliative care when they can access palliative care. And we are a new organization that has combined aging and disability and are still finding our way and how best we can help inform policy. For the work that we're doing in this space, we will lead I have two hats, and I will lead as Assistant Secretary for Aging. We will approach this issue primarily as an end-of-life, older population kind of project. But I think it's very important also to remain closely engaged with people with disabilities and their advocates, because end-of-life issues are critically important to people of all ages. And we must be culturally competent in this space as we work with people with disabilities. I reached out to them immediately after I finished the CTAC speech. The issues with regard to people with disabilities are complicated. They must be driven by people with disabilities. Nothing about us without us is real. And in working in that kind of partnership, it's important to realize as we talk about advanced illness and end of life, that many people with disabilities have really built a civil rights movement in order to show the value of their life, and that we need to respect that value and that they need to leave on how it would be for them to make decisions at the end of their life. So we will talk about aging, but we must never forget as we're implementing programs that there's a broader perspective. We will work to expand, like I said, the consumer information that we can provide, thinking a lot about the work that we do with caregivers, with people with Alzheimer's and related dementias. And we also want to help coordinate our federal partners that you will meet today. I was telling John before we started, that actually has already started just in lead up to this meeting. Pat Grady, who will be here, who's the head of the National Institute for Nursing Research, we had a meeting with her. They've done a lot of work on palliative care for children. We talked about sort of their interest in an older population and how they can move forward. There are a lot of people at HHS interested in working in this space, and I think our ability to continue to bring them together to be a convener of sorts will be helpful. I also think it's important that we challenge the aging network. When I started talking about this a little bit more about a year ago, I went to the monthly meeting of the Leadership Council of Aging Organizations and gave them this charge. And I usually go and I try to listen more than boss them around. And in this particular meeting, I went and really tried to issue a charge that if you're working in the field of aging, you must be competent to talk about palliative care, to provide support for people who need it and their families, and know about it. And we need to do more specifically in terms of education and training and cajoling and leadership with the Aging Services Network so that they know about the services and can work directly to incorporate them into their programs. We also need to pay attention to the needs of consumers. We pull data every year. We do a national survey of Older Americans Act participants, the programs that we're funding. And we're going to start adding palliative care, end-of-life questions to the survey information that we pull in 2015 so that we can get more information about what the unmet needs are of consumers. We are going to, Senator Warner's going to come. I mean, Senator Warner's presence today has a direct kind of connection to the fact that on issues like this, you simply need to begin by talking to a lot of people. And he is interested in this topic. He and I met. I had a draft agenda, and I said, I know some people who are interested in this issue as well. So I encourage you all in your work, in your communities, to simply ask people to join us in this work and figure out a way that we can move forward. I'm very, very interested in the connection between staying healthy and dying well, and how this part of life, this arc, respects the individual, respects their goals, and provides a good quality of care and good quality of life. And we will do anything we can to help advance the work that all of you are doing. So thank you again. I'm actually finished, so let me turn it back over to John. Thank you.